The Prevention Centre is one example of a new initiative from the National Health and Medical Research Council, which brings together formal researchers with policymakers and practitioners to fill the gap, to fill the knowledge translation gap. We currently do lots of good research in this country that helps us better understand what we can do in prevention. But a lot of that is not being reflected in what we do in practice and policy. We see ourselves as working with our partners, both the ones who fund us, but also more beyond that, people working in the health system and systems which impact on health more generally, of working with people in those situations to help them understand what the evidence suggests is what might work, what the experience of others trying to solve the same problems are, to create a learning environment within prevention so that we learn from each other, we learn from previous experience and we learn from the research. The Prevention Centre doesn't necessarily see itself as discovering a whole lot of new research, because there's a lot of research out there which is already not being used to inform policy and practice. We see ourselves as bringing together, identifying that information. We use the term synthesising that information, both formal, the information which is published, but also the learned experience, what people have actually done in practice, and then bringing that forward and helping people to develop programs and implement programs in a way which is most likely to be effective given a particular situation or context.